we're going to get to our movement patterns. You want to take this alignment, because remember, you have to encourage this alignment in the upright position. So let me do this first. I'm going to use my band, and then we'll all do this together. Just watch me first. You've all done some exercise like this. You've all done some kind of lateral band walk, so like this, yes? And when we watch what most people do them, not like that, right? Most of our clients don't do a great job. They're kind of like this, yes? So we actually don't have them walk. What I want them to do is, first thing, stay long in their spine. Second thing, hinge their hips. Their alignment, they should already know where their alignment is from that last corrective exercise. They're going to hinge their hips. When they step out, their hip, knee, ankle, and foot should be aligned. They're going to really focus on that foot tripod on the ground. This becomes my stationary leg, my left leg. I'm going to step out, touch my toe, come back. All my weight is back here in my hip, so that way I'm not here forward in my knee. I sit back in my hip, and all the weight should be back in my hips. So from the side, it looks like this. Align your spine, put your foot tripods down. So big toe, little toe, heel. Hip hinge, now step out to the side, come back. So that way, if you notice, nothing moves here, correct? Nothing's moving here. As I step out, come back, nothing's moving. I'm working a stationary leg. You're not working the moving leg. It'll do some kind of work, but the work is being done to teach the client how to use their hips and align that hip, knee, ankle, and foot so that they eventually can come into single leg stance and keep that same alignment, okay? Put your band on, let's have you stand up. Band above the knees, make sure it's flat, not rolled up. Stand up, feet about shoulder width apart. No, not shoulder width, hip width apart. Get your foot tripod set first. Put your feet down on the floor. They should feel nice and connected to the floor. Long spine. Hip hinge. Get your weight back in your hips. Everybody got it? Keep your core stacked. Okay? Now, put your weight on I'll go with my right side, you go with your left side. Put your weight more on your left side. Look down. Is your hip, knee, ankle, and foot aligned? Is your foot on the tripod? Okay? Now step out with tap your toe, but keep your weight on your left leg, your non-moving leg. Step back in. Step out, touch, come back. You should keep that alignment the entire time. There should be no change in your core alignment and or your hip, knee, ankle, foot alignment. If you're doing this right, you should feel it where? Glute. Maybe a tiny bit in your quad, but mostly in your glute. If you're not feeling it in your glute, you need more hip hinge. You need to sit back in your hip more. And if you can't get it there, come see us at our table. I'll show you how to get there. It's very, very simple. Good, and then relax.
How many?
How many reps? How many was that? 8, 10 maybe? Do you need that many reps? No. Usually 10 to 20, depending on who the client is, okay? So, set yourself again. Get the foot tripod down. Long spine, hinge your hips. Get the weight back in your hips. Keep the hip, knee, ankle, foot aligned. Now step out to the other side. Tap, come back in. Keep the weight all on your right leg. Keep the foot tripod, stay long through your spine. You should feel it mostly where, if you're doing it properly? In your glutes. So you're taking that alignment from your corrective exercise pattern right into the upright position. So that way you start to really teach the client how to own that alignment of hip, knee, ankle, and foot complex.
So could you
cool.
Have a
take your band off?
Or the wall?
Yes, you can always. Yes, you can always have a wall. Put your hands against a wall, right here, same idea. Same exact thing, or a bar, or a chair, yes, exactly. All right, I gotta finish up to get you guys out of here in time. Our table is right outside the corner here. Feel free to stop by at any time today or tomorrow, and I'll answer any questions or show you anything that you guys want, except for what's wrong with you. But I'll help you with anything if you have any questions, okay?